Have you ever wondered how to figure out what's causing chronic systemic inflammation, especially in a hospitalized patient, when you can't find infection, you don't see a cancer, you're not sure what's causing it, and you think it's got to be an autoimmune disease, but you don't know which one it is? How do you approach that? We're going to give you a way to look at that today. Let's go.
All right, we're moving.
We're going to start with something called the MAID differential. So we start with M for malignancy, A, autoimmune, I, infection, and D, drugs. Now, when we take each one of these, malignancy is not super common, but it is a common cause of this presentation. And that is a paraneoplastic syndrome causing fevers or elevated SED rate or inflammatory markers or autoantibodies. And especially hematologic malignancies are known for this, and they're hard to find. So malignancy is one thing you need to think of. Autoimmune disease certainly is where rheumatology gets involved, and autoimmune diseases will present with systemic inflammation. The problem is, these usually are clinical diagnosis patterns, and if the clinical pattern is not clear, it's going to be difficult to be confident that the immune system is abnormal. So this is the only place where the immune system is abnormal. All these others, the immune system is normal, and it's reacting to something external that is abnormal, either malignancy, infection, or drugs. The next thing we're going to look at is infection. And infection statistically is going to be the most common cause of this presentation, but it's going to be at times where the infection just isn't obvious. You can't find any positive blood cultures, you have no clear source of infection, and it doesn't look like an infection is causing that. However, since infection is so much more common than the rest of these other things, you're more likely to have an occult infection that you haven't found than you are to have any of these other things. So sometimes it can be an active infection that is hard to find. Sometimes it can be just a prolonged response to a difficult to find infection, like a viral infection. And sometimes it can be post-reactive inflammation from an infection where there may be retained antigen from the infection but no living organisms. So infection is still the most common. The last is drugs. And although this isn't very common, you do want to think of this because there are certain drugs that will trigger a systemic inflammatory response. And you need to think of those before you go off on a large workup for other things. So the way I approach the MAID differential is actually a little different. I use the word MAID just because it's a mnemonic that's easy to remember. But what I like to do is switch those letters around in the order that I want to think of them. So infection, like I said, statistically is the most common thing, and so you want to think of infection first and look hard for that and make sure there's no stone left unturned in regards to infection. Usually there's going to be things like some hazy infiltrates where you may just need to get a BAL or some kind of tissue sampling to make sure you're not dealing with infection. We tend to do a lot of surrogate markers for infections, blood work and cultures, but sometimes if you haven't done a tissue culture of the most significantly involved organ, you really haven't fulfilled the infectious disease workup as much as it needs to be done. Like I said, drugs need to be thought of. Things like minocycline in young girls who are on it for acne, or at least they used to be, will cause hepatitis and drug-induced lupus, and no reason to do immunosuppression, just stop the drug and the inflammation goes away. And there's several others we would need to think of in that regard. Now, malignancy is going to be an occult malignancy. Usually not a solid tumor, although there are some that cause systemic inflammation, right, like renal cell carcinoma. But usually these are hematologic malignancies, and you're going to need a bone marrow biopsy before you can be sure that there is not an occult malignancy behind the inflammation. And I've had this many times where the answer is found in the bone marrow, either through culture or through the pathology. Finally, autoimmune diseases can present in unusual ways, but it's going to be difficult to make a pattern diagnosis of an abnormal immune system causing this until you've ruled out these more common causes. So when we talk about the MAID differential, what I want you to remember is that the MAID differential has to start with a workup for infection. And you have to not only do all the surrogate markers and blood cultures, but you have to get tissue sampling of involved organs to make sure that infection is not causing the problem in that organ system. Secondly, you need to think about drugs and just make sure you're not missing them. They're not common, but you don't want to miss it and do a big workup. Finally, you want to think of malignancy and make sure that you're not dealing with an occult malignancy, especially in the bone marrow. So I'd say that in terms of evaluation, after you've thought of the drugs and made sure it's not that, make sure there's not an organ system that needs to be biopsied for both culture and malignancy. And with infection, the most common thing I've seen is the lung. And in malignancies, the most common place where I've seen tissue biopsy be revealing is the bone marrow. And once you've done those things, then I think you can say, well, maybe this is an unusual autoimmune disease. But just to put a little note on the autoimmune disease, often the reason people start thinking of autoimmune disease is because the ANA is positive or the RNP or some other autoantibody. And just so you know that just because these are positive does not mean that that's autoimmune disease. That a normally stimulated immune system by infection, by drugs, or malignancy will often produce positive autoantibodies. So that hopefully will help you to keep from being tunnel visioned on other things and give you a workup that starts with ruling out infection, make sure there's no drugs, make sure you're not dealing with an occult malignancy, and then evaluating for autoimmune disease after that.